Hi, everyone. This is Kylene with Parents for Public Schools of Pitt County. We are doing a segment today, a question and answer session around the topic of substance use. And you may wonder why is Parents for Public Schools doing a segment about substance use. But I think all of us as parents know that we want to understand what our teens might be facing, whether it's in school or with people they meet at school, or just in the community, in their neighborhoods, in their world. And we had a workshop on this a couple of years ago, and it went really well. So we wanted to come back to this topic and see how things have changed. Today, we do have a guest with us to do the question and answer session. We have Jennifer Matthews, who is a former member of the Pitt County Coalition on Substance Use and is currently managing the Drug-Free Communities Grant at ECU, which funds the Pitt County Coalition on Substance Use. Jennifer, it's great to have you here with us today.
Thank you so much for having me. I appreciate it.
Absolutely. So, Jennifer, you do a lot of research on substance use among young people and how we can really address that as parents and in our community. So one question that some parents really wanted to know is, what are the substances out there right now that our teens are interested in, or having access to? What's that trend looking like? I bet it's something different than our parents had to worry about.
It's definitely different, I think, in a lot of different ways, actually. But so we do have data for Pitt County high school students. Every couple of years, we collect data from the high school students, and the most recent data was 2019. And in that data, high school students were telling us that the substances they're mainly using are e-cigarettes. Vaping has been and continues to be a pretty big issue amongst that population. Alcohol use, about 1 in 5 students report consuming alcohol, and about 1 in 10 do so at levels that are high risk drinking. So that's usually defined as 5 or more drinks in a row or in a setting, so usually within a couple of hours. And then some other substances for drugs that we see in Pitt County are opioids. I think our opioid rates are about 1 in 5 as well. And then you have methamphetamines, which is we're actually seeing an uptick of from 2017. Opioids is up from 2017 as well. And nationally, we're seeing methamphetamines becoming coming back around. I think what we see with drug use is there's always sort of one drug that we're seeing more of, and that whatever that drug is kind of rotates around. So I'm sure maybe parents remember years ago where methamphetamines was it was in the news, it was a really big issue. Well, it's now coming back around. I think those are probably the top ones that we see in Pitt County. And I will say all of those are up from 2017. Alcohol is on average the same as what we would see across the state and across the nation, but opioid use, meth use, and vaping are all above state and national averages.
Okay, all right, that's all good to know. It's not good to know because we're glad to have it, but really, really good for us as parents to know just what's out there.
Yeah.
I do want to take a moment and just toss it out there that you mentioned that that you have statistics from what's being used in our high schools in Pitt County. And we all know that there are lots of resources, and our school social workers and our school counselors and teachers and principals all do everything that they can to be there as resources for our students.
Sure.
And I wonder if you know of other resources available in the schools, like groups that are addressing drug use, or what a student can do if they suspect that a friend has a substance use problem, to maybe give some guidance there if parents wanted to address this in their school.
So they do have students against it's sad, student destructive decisions. Sorry, it's been a lot of different things, and that normally operates within all the schools in Pitt County. I think there's a chapter in every high school and every middle school. Obviously, right now with COVID, they're not doing regular things, and so that's something that hopefully we'll get back to in the future. There the students are learning things in health classes. That's a state mandated curriculum. But outside of that, there's really not a whole lot that's going on within the school. I'm sure they'll do special assemblies. Most schools do. Usually around prom time, you might see something related to like a car crash at a school or something along those lines to raise awareness. But there is specific programming funded through Trillium by Port. So there is somebody that will work with individuals, not at a population. These are real specific to individuals who are mandated for education for, if they've been, if they have substances on campus. But outside of that, there's really just the individualized resources that the counselors, social workers, nurses can provide. And then the Pitt County Coalition on Substance Use also has a youth team. And we've still been meeting because it's outside of the school system. So they've still been meeting. They meet every couple of weeks. And they've been doing things like on our social media pages and in some avenues that they have access to. But again, it's really difficult with COVID right now because we can't actually meet on campuses. So.
Yeah. Side note, just a big thank you to our social workers and our counselors, and families do know that those are always a resource for you in your schools. If you suspect that your student is struggling with substance use, then a counselor and a social worker are a great first point of contact. And then some of these other resources can be tapped into. Jennifer, you really mentioned that COVID has really changed things. So students aren't necessarily meeting with their SAD group right now. And school is sometimes happening at home right now, which means substance abuse might be happening at home sometimes, which is not something we want to think about, but maybe a reality. So obviously COVID has changed a lot of things. Students are home more. These supportive groups aren't as accessible. Tell us a little bit more about some trends that you've seen happening really during the past year since we hit the COVID crisis.
Yeah, so across the country, we're definitely seeing substance use increase. I mean, across all ages, not just youth. And I will say that I've looked at the data for Pitt County. We don't have use data for Pitt County over the past year. It's just too soon to have any of that data. But if we look at alcohol sales, that gives us a good indication of what we might be seeing in use. And alcohol sales since March of last year, so literally in the past year, is up on average 26% every month. So that tells us, and I would say for a large portion of those, the restaurants and bars were either closed or couldn't serve alcohol. So a lot of that is coming from what we call off-premise retail outlets. So where you go buy alcohol and take it home to consume. And the problem with that for youth is that now you have parents who are buying this alcohol and they now have it at home. And kids are home more. So that means that they have a greater access to that. We also know from our data from Pitt County that students tell us that the primary place that they get their alcohol is from their house. And just as a side note, I think it's close to half of the students who reported consuming alcohol, that the type of alcohol they typically consume is liquor. So they're not going for, Mike's Hard Lemonade. I just showed my age because people don't drink those anymore. Or a beer from the fridge. They're looking at your liquor cabinet and getting out. That's where they're getting their alcohol from. So just something to consider when you're looking at, what's going on at home. I'll also mention that, delivery has changed. We can now have alcohol from restaurants delivered to your house or picked up by you to go. And some places are doing really great job with checking IDs to make sure that, the people who are picking them up are 21. And there are some places that aren't. And we've been conducting those tests as a part of some research that I'm doing here over the past year. So I'm seeing it here in Pitt County both ways. So it's about awareness, like knowing what the possibilities are that are out there. And research will tell us that if you have increased access to alcohol, that immediately leads to increased substance use among youth. So that's just just some considerations to take into account. The last thing I'll mention is that mental health is really suffering right now. I mean, people, kids, I mean, all ages, mental health has just become such an issue with COVID. It's always been an issue, I will say that, but now we're seeing so much more that sometimes substances can be used as a coping mechanism. So a student that might ordinarily not be interested in drinking, say at home, might once take a sip or have a beer or have a glass of wine or whatever, and they can feel sort of a calmness, or in some way it helps them, and that might then lead to that being their way of coping. So again, these are all just considerations to take into account when you think about what's going on.
Yeah. You mentioned that that sometimes, or you mentioned that it sounded like you said 50% of students, when they do consume alcohol, it's from home. And of course, all of us as parents want to think that's not happening with our children. And it may not be happening with your child, but maybe it's happening with their friend. And so one thing we want to talk about is, so, certainly parents are welcome to buy alcohol and make those purchases. They're of age, and that's an okay thing for them to do. But what might be some things that parents might think about, maybe some strategies to put in place within their home to think about some preventative measures, so that it's an open conversation in their home, and they're taking preventative measures so it doesn't become a problem for the teen living in their home.
Right. So I would say the number one thing you can do is talk to your child. I think a lot of times parents feel as if they aren't as influential in their child's life, particularly as a teenager. But teens actually want you to ask about their life. I don't know. And when I say talk to your child about alcohol and drugs, I don't mean having like a 2-hour conversation and sitting down and having like one big conversation. Just take teaching moments. If you see an ad on television, or something in a movie, or if you see something in public, take that as an opportunity to start talking with your kid about that, or simply just asking about their day. I know a lot of times teens will roll their eyes and be like, "Oh gosh, mom," but they actually really do appreciate you asking about that stuff, because it shows that you're interested and engaged. Normally I work from home. I have 3 small children. So I know when you're at home and you just want to get things done, whether it's clean the house or cook dinner, or if you're working from home. But throughout the day, it is important to kind of take opportunities to just check in with your child in one way, shape, or form. So this communication is pretty key. And I say start early. Don't wait till they're teenagers, because then it becomes not, then it's like, "Mom, why are you asking me about this?" Right. And I have one of my sons is 4, and his entire life, he liked to be rocked to sleep. And even though he's 4 and he goes to sleep on his own, we still spend, 5 to 10 minutes every night of sitting in the chair in his room and just talking about stuff. And sure, we're not talking about alcohol and drugs at the age of 4, but what I hope is that conversation, it'll be normal for him to have these conversations with me as he gets older, so that it's normal for me to start asking about different things, age appropriate things, as he gets older. So it's one of those, things where you can start at any age just to prep them for those conversations. The
So
other
it's
thing
really about a culture of communication, and just starting with very small talks, just open communication, and having your child just expect that talks are going to happen.
Yeah.
And then you can bring some of the more difficult conversations in as the ages increase.
Yeah, and I'll say approach those conversations very non-judgmentally, right? I mean, if they start feeling that you're judging them for some of the questions that they might be asking, or some of the things that they might be doing, and I know it's hard not to be judgmental because it's human nature, but as soon as they just shut down, and they don't want to have those more difficult conversations with you. So really try to approach those as small conversations where there's not a lot of judgment in what you're presenting. Make sure you're presenting your expectations as a parent. You don't condone alcohol use, right? I mean, it's illegal for parents to provide alcohol or drugs, but it is illegal for parents to provide alcohol to their kids. except for small portions in religious ceremonies. But make sure that you approach these small conversations and continue to have those conversations, and that you really provide your expectations for what's happening in your house. And don't be afraid to say, this is, my beliefs, this is what I expect to happen in my house, and just make sure that you enforce those expectations.
So really open conversations, clear expectations. Those are two very preventative measures that parents can take when thinking about preventing substance use with their teens.
Yes, and there's two physical things that you can do in your house too. Number one, it's lock up your alcohol. We actually have alcohol locks with the Pitt County Coalition on Substance Abuse that you can put on top of a liquor bottle or put on the top of a wine bottle. And the only way you can access it is with a key or a combination. So that way it prevents, I'm sure parents perhaps might recollect that you taking alcohol and then filling it up with water because it's clear, and so that prevents some of that from happening. Putting a lock on a refrigerator, if you have a beer refrigerator outside, is also helpful. We also have lock boxes for drugs. So any prescription drugs that you might have at your house. The high school students in the survey that we did in 2019 stated that the number one place they get their prescription drugs are from at home or from their friends who probably get it from their house as well. So we do provide lock boxes that people can take to lock up their medications at home.
Great. So we have some non-tangibles, that open communication, that setting clear expectations, and then some very tangible things that folks could contact the Pitt County Coalition on Substance Use to obtain a lock for alcohol and for prescription drugs. So parents, that's really good news. There are things that we can do to prevent substance use becoming an issue for our young people. So Jennifer, I know a lot of parents, and a question that we got from some parents when we put this out was, what do I look for? So, my teen's been home a lot this year, and I don't think they're using substances, but what do I look for to make sure that I know?
I wish it was like a clear cut, these are the signs. If they have these signs, then that's definitely it. But sure, if you notice that all of a sudden the amount of beer or liquor in your cabinets are less than what you had thought was in there, that could be a sign. If your child perhaps is having just out of the blue crazy mood swings, and you can't really figure out what's going on or where that might be coming from. If they have a new group of friends, or if they've sort of left a group of friends that they've had for a very long time, these things might be signs. If they're stay in their room a whole lot, eyes, red shots, bloodshot eyes. Those are usually, I think, the things that people start to pick up on as initial sort of what's going on types of things. And I say that also because you might not, if you had conversations with your kids, then you might hear that they're hanging out with new people, or they're not hanging out with their old friends anymore. So that's another way that even those conversations can kind of guide you into, or perhaps provide hints as if there's something going on in their life. But those are probably the main signs, I would say.
Okay, thank you. So let's say that the inevitable, or not the inevitable, but the undesirable has happened, and none of us hope that our children have a substance use problem, but you're telling us that it's happening more and more. And so let's say that a parent does discover that their child has begun to use substances. What might a parent do to address it if it's already happened?
So I think that it kind of depends on the severity of use, right? So if it's just a kid that's experimenting, and because it can take a little bit for like even alcohol before you have a substance use problem. And so I want to delineate between the two. Like if you just catch your kid at home smoking, although tobacco is the single most addictive, nicotine is the single most addictive substance you can have. Address that, with them, talk to them about that, figure out what's going on. Again, conversation becomes really important. Consequences, set boundaries, expectations. But again, it kind of depends on your parenting style too. But if you notice that they have a substance use problem, then they need to seek treatment. And there are options. I won't say that there's lots of options, but there are options even around Pitt County. And we have some of the services available on our website that you can look at. But treatment's one of those things where it's not a one size fits all approach. You really have to figure out what type of treatment is could be most useful for you or for your child. But yeah, start exploring options for them to get, but that really is if they have a substance use problem. And I want to reiterate too, I don't know if I've said this before, but I do want to say that, of the substance use issues, misuse is most common. And that just means that it's illegal, they shouldn't be using it. Or if they are using it legally, in the case of prescription drugs, that they might be using it not the way that it was intended. And substance use problems, very few high school youth actually end up with a substance use problem. I don't want to say that it's non-existent because clearly it exists, but most of what we're seeing is more misuse rather than substance use problem.
So as disheartening as it is to know that some teens are going to fall in this path of a substance use issue, it is encouraging to hear from you, Jennifer, that misuse, it has ways to sort of correct itself. So as parents, there are resources available to address that misuse so that it doesn't become a substance use problem.
That's correct.
Thank you for really differentiating between those two. I think parents, that's an important thing to know, that misuse doesn't necessarily equal abuse or a use problem. So a couple of parents asked when we put the question out there, what would they like to know, is really what resources are available. And you touched on those just a little bit just now, but maybe you could share with us some specific resources. And I know that you have a website that might be helpful for parents. So just talk us through specific resources that parents might reach out to if they really wanted more information on this topic.
Sure. I'm going to share my screen so that you can see PICSA's website. So this is PICSA's updated website. This is their homepage.
And when you say PICSA, can you tell us what you mean?
Yes, I'm sorry. It's pccsu.org. And under resources at the very bottom, there is a parent resource page. We just implemented or developed all the resources for this over the past month in anticipation of trying to do some things around for parents in the month of March. So here you can see some risk factors, some warning signs that all can exist. Some facts about reducing, what can you do? And then at the bottom, you'll see some resources. So I think one of the best resources is this SAMHSA underage drinking parent resources page. And yes, it talks about parent resources for alcohol use, but it covers all substances. So I personally think this is a really good page to explore. But down here, there's lots of different options for resources that parents can check out. And of course, if they have specific questions, they can always email PICSA and you can contact us and we'll respond. We have some specific booklets that we usually hand out in person, but obviously we're not doing that right now, that I can send PDFs of, or Lily, who's the executive director for PICSA, can handle emailing some of those out as well.
Great. And so PICSA is the Pitt County Coalition on Substance Use. Pitt County Coalition on Substance Use. It's a long name. I have to get used to saying it.
Yes.
But
we just changed it too, so some of us have to get used to it as well.
But I did see that there was a contact tab there on the website. So parents, whether you're looking at prevention, you're really working on recognizing if there might be something happening, or you've had an issue at home and maybe a step of misuse, or maybe you're suspecting a problem. There's ways to address it. And so the Pitt County Coalition on Substance Use is a great resource to reach out to, and they can connect you with the resources that would really be the best fit for your family. Because as Jennifer said, there's just not a one size fits all. So it would be about figuring out what's best for your family. So parents, thank you for watching today. Jennifer, thank you so much for talking with us. Again, this is not the happiest of topics that Parents for Public Schools puts out in the community, but we have put it out a couple of times, and March is Substance Use Awareness Month. Is that right, Jennifer? Am I saying
April
that?
is, I mean, there's something every month, but yes, there's some in March, but March is for us is just focusing on parents. We know that parents need the resources, particularly right now with COVID, and we're just concentrating on making sure that we get the resources out there. April is Alcohol Awareness Month, so you'll see some more from us that's alcohol specific next month.
All right. So we wanted to take some time to just share resources with parents. You know, we're hearing from Jennifer that COVID has brought a rise in this topic. And so we want parents to have the information that they need. And because we are Parents for Public Schools and we do try to tie everything to the schools, I'll just remind folks again, you may have never needed a social worker or a counselor at your school. That's happening a lot during COVID. There's families who are needing the school social worker or the school counselor for the first time. So just know that if you've never used them, that's okay. It's okay to make this the first time and to reach out to them and let them help you connect with resources as well. Thank you so much for your time today, Jennifer, and thanks to everyone for watching.
Thank you for having me. I appreciate it.